Hi everyone, welcome to today's special episode. How are you feeling today? I hope you're in a cozy, relaxed mood, ready to hang out and chat with me. Today, we're going to talk about something that might sound familiar to some of us. OCD, or Obsessive-Compulsive Disorder. Have you ever found yourself checking the door over and over again before going to bed? Or felt the urge to wash your hands repeatedly until you're sure they're clean? Well, it might seem a little like OCD, or maybe not. Let's dive in together and learn more. By the way, do you know the difference between regular perfectionism and OCD? Stay tuned. We're getting into it right after this. Before we get into how to manage OCD, it's super important to really understand what it is. OCD, or Obsessive-Compulsive Disorder, is a mental health condition where someone experiences obsessive thoughts, meaning unwanted, repetitive thoughts, and compulsive behaviors, which are repetitive actions done to try to ease the anxiety from those thoughts. A simple example: someone might feel the need to wash their hands multiple times because they're overwhelmingly afraid of germs, even when their hands are already clean. But OCD is not just about being super clean or organized, and that's a common misconception. It's much deeper. It often feels like the brain is stuck on a particular worry, even when the logical part of you knows it's irrational. And despite knowing that, the anxiety can feel overwhelming. There are different types of OCD too. Some people struggle more with checking things like locks or appliances, while others wrestle with intrusive thoughts that can be disturbing or frightening. Some focus on symmetry and order, and others have fears related to contamination. And it's important to know that OCD is not a personality quirk. It's a serious mental health condition that deserves compassion and real support. Thinking about it, have you ever found yourself stuck worrying about something to the point where it's hard to stop thinking about it? Imagine if that worry loop kept going and going, making you feel you had to act on it just to feel a tiny bit of relief. That's a little glimpse into what OCD can feel like. All right, now for the good part. How do we deal with OCD? First up is therapy. And one of the most recommended types is CBT, or Cognitive Behavioral Therapy. 1. Cognitive Behavioral Therapy, CBT. CBT focuses on helping us understand the connection between our thoughts, feelings, and behaviors. In the context of OCD, the specific branch called Exposure and Response Prevention, ERP, is considered the gold standard. ERP might sound a little scary at first. It asks us to face the very thing that triggers our anxiety, but, and here's the key, without performing the usual compulsive behavior that we usually use to reduce the anxiety. For example, imagine you're terrified of germs. In ERP, you might be guided to touch a doorknob, something you might normally avoid, and then resist the urge to immediately wash your hands. And it's not a throw you into the deep end kind of thing. It's gradual, step by step, like climbing a ladder, one rung at a time. Therapists work closely with you to create a hierarchy, a list of fears, starting from the least scary to the most terrifying. And slowly, patiently, you work through them together. How brave do you think you'd be if you had to hold off on reacting? Light tone, maybe more than you think. 2. Mindfulness and acceptance. Besides CBT, mindfulness-based therapy can be really powerful. Mindfulness teaches us to stay present, to notice our thoughts without judgment, and this is important, without trying to push them away or fight them. For someone with OCD, intrusive thoughts can feel really threatening. But mindfulness helps you recognize, hey, this is just a thought. I don't have to obey it. I don't have to believe it. Over time, practicing mindfulness can weaken the grip OCD has on your daily life. It's like learning to surf the waves rather than being knocked down by them. Let's actually do a tiny mindfulness check-in now. Take a deep breath in, hold it gently, and exhale slowly. Notice the way your body feels. No judgment, just noticing. 3. Group therapy and peer support. Sometimes, talking with people who are going through similar things can be incredibly healing. Sharing experiences can make you feel less isolated. Hearing someone else say, "Yeah, I've been there too," can be incredibly validating. Support groups, whether in person or online, offer a safe space to share struggles, celebrate small wins, and learn new coping tools. Recovery doesn't have to be a lonely road. Now, besides therapy, sometimes OCD also needs medical support. And that's completely okay. 1. Medications, SSRIs and SNRIs. Doctors might prescribe antidepressants like SSRIs, selective serotonin reuptake inhibitors, or SNRIs, serotonin and norepinephrine reuptake inhibitors. These medications help regulate serotonin, a neurotransmitter that's often out of balance in people with OCD. Some commonly prescribed SSRIs for OCD include fluoxetine, Prozac, sertraline, Zoloft, and fluvoxamine, Luvox. Now, medication isn't a quick fix, and it usually takes a few weeks to notice real changes. Plus, some people might experience side effects in the beginning, like nausea, dizziness, or sleep issues. It's really important to work closely with a psychiatrist who can help adjust the dosage if needed and support you through the process. 2. The role of psychiatrists. Psychiatrists don't just hand out prescriptions and send you on your way. A good psychiatrist takes time to understand your specific needs. Maybe therapy alone isn't enough. Maybe medication alone isn't enough. Often, a combination of both therapy and medication leads to the best outcomes. And treatment is never one size fits all. It's personalized. Because your story, your challenges, and your strengths are uniquely yours. Ever heard of the 80-20 principle in OCD therapy? It's the idea that a small part of our actions, like facing a small fear, can lead to huge improvements over time. Cool, right? We'll dig more into that in a bit. Besides therapy and meds, there are daily habits that can help support your healing journey. Recovery is not just about the big therapy sessions or the medication. It's also about the small things you do every day to take care of your mind and body. 1. Creating a routine. Having a consistent daily routine can really help. When life feels chaotic, anxiety can spike. But if you know what to expect, even little things like having breakfast at the same time each day, it can create a sense of stability and predictability. Small routines anchor us when the world feels overwhelming. 2. Stress management techniques. Stress and OCD are best friends, and not in a good way. Learning ways to manage stress, like practicing yoga, deep breathing exercises, progressive muscle relaxation, or even just going for a mindful walk, can make a big difference. And remember, it's not about eliminating all stress. That's impossible. It's about learning to respond to stress in healthier ways. 3. Support from family and friends. OCD doesn't just affect the person who has it, it can also ripple out and affect family and friends. Open communication is key. Letting loved ones know how they can support you, whether that's giving you space, encouraging your progress, or simply listening, can be incredibly healing. And for friends and family members, just being there, without judgment, can mean more than you know. 4. Self-compassion and journaling. Self-compassion isn't about letting yourself off the hook or ignoring problems. It's about recognizing that struggle is part of being human. Instead of beating yourself up for having a tough day, you offer yourself the same kindness you'd offer a close friend. Journaling can be a beautiful tool for this. Writing down your thoughts can help you untangle them. You can celebrate small victories, and trust me, every little step is a victory. Here's a gentle challenge for you. After this episode, grab a notebook and write down one thing you're proud of today, no matter how small. Because healing is made of tiny, courageous moments. All right, friends, we've covered a lot today about managing OCD, from therapies, medications, to everyday strategies. If I could suggest one thing to take away from this, it would be, try just one technique we talked about today. Take it slow. You don't have to rush. Healing is not a race. And guess what? In the next episode, we're going even deeper into mindfulness techniques for managing anxiety. You won't want to miss it. Before we wrap up, a little disclaimer. I'm not a psychologist or psychiatrist. Everything I share here comes from trusted references and relatable experiences. But if you feel you need professional help, please don't hesitate to reach out to a mental health expert. Your journey is unique, and you deserve the best support available. Thanks for hanging out with me today. Take care of yourself, and I'll catch you in the next episode.